Let's take a look at the latest COVID numbers here in Indiana this month. The state reported more than 300,000 new cases, and that's what you see here highlighted in the orange there on this graphic. That's 100,000 more cases than any other month during this pandemic. And as pharmacies and stores start rolling out those free N95 masks, researchers at the Region Strife Institute are now putting out new data on mask behavior here in Indiana.
Yeah, from November 2020 to May of 2021, they gathered 76,000 observations at more than 900 locations. They found that about 85% of adults wore masks in Marion County, whether it was to the grocery store, shopping center, college campus, or gym. But during that 6-month period, mask guidance was constantly changing. Indiana lifted its mask mandate in April, and shortly after, the CDC recommended that fully vaccinated people didn't need to mask up in public. But the whole time, Marion County kept its mandate in place, something that researchers noticed had a large influence on whether people wore a mask or not.
I think it really emphasizes how important local government is in responding to public health emergencies and crises.
Since last spring, Dr. Vest admits mask wearing has fallen off a bit, but says it still serves as an important tool to fight off COVID.
And if you want to wear a mask, N95 or KN95 masks are your best option right now. The CDC says they protect better against the Omicron variant, and they've been hard to find, but the government's trying to make that easier, sending 400 million N95 masks to pharmacies and health centers across the U.S. You can pick some up at Meijer, and Kroger hopes to have some available by tomorrow. There are a lot of other stores that will be handing out those masks as well, like CVS, Walgreens, Costco, and Walmart.
Now, the increase in COVID cases is being felt across the U.S. The nation has now surpassed 71 million COVID cases and 872,000 deaths. Health experts are worried the big push to get COVID boosters is now losing steam. The CDC says only 40% of fully vaccinated Americans have received their additional booster shot.
And Pfizer is testing an updated COVID-19 vaccine that targets the Omicron variant specifically. The study compares its original vaccine to one that's been tweaked to fight Omicron. Now, it's not clear that an Omicron-specific vaccine is needed since boosters have proven to be pretty effective against the strain. Pfizer says they are doing the study for future research just as a precaution.
Well, there's no doubt we're going to need COVID-19 tests throughout our winter here, but there's a new concern about whether those tests can withstand extreme temperatures outside. Our Verify team tells us if your tests are still okay to be used after being exposed to the cold.
We were concerned that since they were out so long, they probably all froze, and we question whether they're going to work for us or not.
Justin Gifford ordered a case of at-home rapid COVID-19 tests for his organization. He says those tests got dropped off over the weekend and sat in sub-zero temperatures until the office reopened on Monday.
The case of Binax tests were covered with snow and presumably frozen through the weekend.
He noticed the requirements on the box that the tests stay between 35.6 and 86 degrees Fahrenheit. So Justin asked us to find out if these COVID tests will still work. Tonight, we're verifying. Will Binax Now COVID-19 tests still work if they're exposed to extreme cold or extreme heat? Our sources are Maine CDC Director Dr. Nirav Shah, the US FDA, and Abbott Labs, which makes the Binax Now tests. All three say, yes, the tests will still work, but there's some important context. Here's what they say. Abbott Labs tells us a temperature range is common in these products. The test should be kept between 35.6 and 86 degrees. If the tests are stored outside that range for a, quote, relatively short period of time, a couple of hours up to a day or two, they will be fine to use. The US FDA backs this up and says, developers like Abbott test these products to make sure they'll still work, even when they're stored in very hot or very cold conditions. The FDA, Abbott, and Dr. Shah all say you need to bring the tests back up to room temperature for at least 2 hours before using them. Otherwise, the cold could affect its performance.
You do want to give that test kit time to come up to room temperature before you use it, just to make sure all of the reagents or chemicals in the kit have had time to make sure that they're fully active.
So we can verify, yes, COVID tests that sit out in the cold for up to 2 days can still provide accurate results, but you have to wait for all the pieces to come up to room temperature before you use them.